Okay, now the IV has been placed in the patient's hand. Started. So the process and steps are in word two. Go ahead. First, find a vessel. Wash your hands. Collect your supplies. Find a vessel by applying a tourniquet at least a little bit above the antecubital so you can see what's a good vessel. Once you locate that, you release it. Get all your stuff together. You go ahead. Wash your hands again. Apply the sterile gloves. Well, my mistake was I didn't apply my tourniquet again before I actually applied my sterile gloves before I started the process. So apply the tourniquet again. Check the pulse. Make sure that you're getting a pulse still because you don't want to occlude the artery, just the vessels. And then you clean it 30 seconds. Find your vessel. First, you go ahead and make sure your extension is flushed. Anyway, find your vessel. Insert the gel coat. Lay it flat. Bevel up 15 to 5 degree angle. Advance. Have to go in a little bit more advanced. You see a return. Well, you should see a return before you do any of the advancement and everything. Before you go ahead and lay it down, you see your advance. That's how you know you got it in there. Your flash, should I say, not your advance. And then you go ahead and advance the gel coat with the little finger thing in the back. Go ahead and secure your placement. Um, Secure your IV with the securement. Tape it. You go ahead, make sure it's still patent. Once you hook up the extension, you aspirate, you flush it. So now I'm getting ready to start. Um, oh, don't forget to release the tourniquet after you finally got your catheter inserted. You go ahead and release your tourniquet then. So don't want to forget that part. So now I'm going ahead and start the IV fluids, confirm the patient information. Again, verify the information in drugs and medication and things against the MAR, including the IV fluids. You're going to document everything that you're ready to do, time, date, placement, what you location of the IV site. You want to document what fluids you're getting ready to administer, the medication, the dosage. Make sure you verify the right route, right patient, all your rights to your medication, right dose, right time. Um, so all those things are verified. So again, knock knock. Hi, how are you? Okay, I'm here. I'm going to get your IV started. So I'm going to raise your bed a little bit, lock it, raise your side rails, and get your fluids running for you. Okay. And before you do anything, you always want to make sure you secure the bed. Lock the bed, raise the rails, make sure they're in a comfortable position before you do anything, basically. Um, Before I started the IV, should have made sure the bed was locked. The rails was raised, patient in a comfortable position, and also document. All right, so well, we at the point. So again, can you tell me your name and date of birth, Mr. John Smith? Your date of birth is 1/15/58. So again, the doctor gave me an order for you to start some IV fluids at 75 cc an hour. You get some antibiotics and also give you some furosemide, which is Lasix. Okay. Okay. All right, but I want to do a quick assessment on you. If that's okay. I want to listen to your. Wash my hands. Okay. I want to listen to your lung sounds to make sure, see how they sound, be nice and clear, things like that. Okay. All right. Your vitals all look within normal limits. And can you tell me do you have any allergies? Okay. And again, you want to make sure are you related to any latex or anything like that? Iodine, shellfish. Okay. All right. So now I'm going to go apply some gloves and my goggles. Just because I'm going to play with some blood, so it might flash back. They're going to fall back off, so I'm just going to take them off so they won't fall in my foot. while I'm taking care of my patient. Um, other goggles I had. Can't find them. Anyway, so hand washing is taking place. Putting on my gloves. Okay. All right. I'm going to turn my pump on. Big beat. Patient information is low. All the rates, everything is in. All the rates, everything is already programmed in the pump. So at this time, I'm just going to start it. So again, I have my cap, I have my flush. I want to make sure my IV side is still patent. I got my, what you call them, scrub hubs. So, this is already clamped off. So, I'm going to take this flush to make sure this is still okay. Exit the air, push the air out of the flush. Asteroid. Alright, get return. Alright, so I'm going to go ahead and disconnect that. Scrub hub it. Okay. Take this off my primary. Which is then I got my outer scrub hub cap. I'm just gonna clean it just to make sure, because I don't know who's been in here since I've been in here. So I'll do it my 8 times. Then I connect that. Nice and tight. Secure. So, like that. Go ahead. Let's start run. Make sure everything is in place. I'll open up all my clamps. It's been alright, got a drip there. Alright. Primary running, secondary running. Everything looks good here. Everything's in place. Secured. Okay. Alright, so I'm going ahead document let time, date, what time I just started. I verified the orders again. We're hanging the capsule antibiotic, and normal saline, 500 mLs, the site of the IV, how the patient tolerated, name, date, right site, right time, right patient, right medication, right route. Make sure I date that, how we started the IV, how the pulse was okay. So now we want to convert to INT. All right. So the patient want to go to X-ray. So now X-ray came up. Knock, knock. How you doing? We need to take him to X-ray. Can you convert to INT? Sure. First, let's check if we can. All right, we check, we verify that the orders is okay, then we can take it off because it's nothing that can't be stoppable. We only taking antibiotics. Antibiotic is done. He's a normal saline only. So, okay, no problems. So, what we're going to do, light hand washing, put on some gloves. Well, you really don't need gloves for this one. So, but provide hand washing. All right, go ahead and stop your IV. Power off the monitor, the pump. Make sure everything's in place. Make sure everything's clamped off. You did see both of the labels, right? Label here and the label here. It keeps sliding down. My label, their label. But anyway, so that's all stopped. So now, what we're going to do is clamp this off. All right, now I'm going to put on some gloves. I want to wash my hands again, just to be safe. Put on gloves. I'm going to give me another scrub hub and my dead end cap. Okay, so you got to order to get ready and go to X-ray. Okay, so yeah, I'm going to disconnect this until you get back. Is that okay with you? All right. I don't forget my dead end cap. Patient's okay. That's been loose. I've been untied that when I did it. Anyway, so what you're going to do is go ahead and disconnect, flush. Oh, you're going to aspirate. You have the red return. Flush it. Still patent, so that's good to go. But wanted to make sure that this is not contaminated. So if you want to be safe, go ahead and get my other dead end cap. Place that on there. Alright, place this on there. And patient's okay. Alright, he's gone. It's okay. You can drop. It's covered. The tip is. Patient is secured. IV site is secured. Okay. Black. Oh, you're back. So how was it? You okay? Did it hurt you any? Oh no. Okay. So let's provide some hand washing. Get you connected back to um your your fluids. All right. Before we start again, I need to re-verify that you are Mr. John Smith and you are having IV fluid 500 normal saline. Okay. I just want to go ahead and listen to your lung sounds because you are due to have order for furosemide 400 milligrams. Now that's going to go through your IV in the hand, okay? Okay. All right, I'm going to verify my medication with the MR. I do have furosemide 40 milligrams, Ivpush. I'm verifying against the MR, furosemide 40 milligrams, Ivpush. Okay. And you have any allergies? Okay. All right, thank you. All right. I'm going to provide hand hygiene. Get my things for my medication. And my alcohol wipes. Okay. All right, sir. All right. It looks like you had your last dose at 2 a.m. So it is 8 a.m. So we're going to go ahead and give you your second dose of your furosemide, 40 milligrams IV push every 6 hours. So it's been 6 hours because the last dose you had at 2. Okay? Okay. All right. So let me get you hooked back up to your fluids first. So again, provide hand hygiene. Wash my hands 20 seconds. All that good stuff. Got my goggles on because they don't tell me if you're getting shot up by blood or not. Okay. So I got my alcohol pads this time. Alright, first I want to get my IV bag, pour it ready. Make sure everything is intact. Alright. Make sure there's no air in there. And a flush. Aspirate. Got red. Okay. So that's okay. Then I'm going to remove that end cap. Insert. The other alcohol pad, just in case. Better safe than sorry. Okay. Alright, we secure IV. Alright, IV secured. Turn pump. Water push start. Hit patient info or select. Then the patient information should recalculate if everything is programmed correct. And again, his rate is still 75 cc's and everything is still programmed. All the information is verified against the MR. This is the first patient, Mr. John Smith. You're ready to run his. So now everything is open. Hit start, run. Make sure all the roller clamps are open. And it's not done till you see a drip. Okay. All right, sir. Well, all right. Now I'm going to go ahead and give you your injection of your furosemide, 40 milligrams. All right. Okay, I'm going to recap this. Never recap a dirty name with it's still clean. Do it that way. Put it back in as clean. Okay. So now we're going to give him an IV push of furosemide, 40 milligrams, which is due every 6 hours. He had his last dose at 2 a.m. Dose at 2 a.m. Now he's going to have the next dose at 0800. So I'm going to get an alcohol pad. Or my new favorite, dead end caps. And dead end cap. Drop the medication. Need an alcohol pad for that. All right, so I want to give the patient 40 milligrams, which is 4 mLs, because it's 40 milligrams per ml. 10 milligrams per ml. I'm going to give him 4 ml. So clean the valve off with alcohol, like you say, it's supposed to. Just clean a little rubber part. Don't do too much with it. All right, and now I'm going to uncap the needle like this. All right, I'm going to pull in the air of what I want, which I want 4 mLs, 5 ml syringe. Put the air in. Invert. Pull back. Okay. Medication drawn. All right, we're going to recap so we get to the patients, so we get ready to insert the medication. Okay. All right. Now, hand hygiene, blah, blah, blah. Washed. Okay, sir. Now I'm going to go ahead and give you your Lasix, okay? Yes, sir. All right. Okay. Now this is ordered IV push, so I'm just going to clean this port. 1, 2, 3, 4, 5, 6, 7, 8. Okay. I'm going to give you 4 mLs of furosemide. Okay. Slow over 1 minute. Okay. Withdraw. Safety gauge. Gauge. We'll place in a sharp bend. Okay. Then again, you would go document. You gave the furosemide at what time. Are you tolerated any reaction? The IV site, how it look, is it irritated? Okay, so that's it. Coming back. So you have any questions? All right, safety, bed, safety is engaged. Raise rails, bed in lowest position. Call light and reach. Okay, so well your IV is started. You're getting, we explained to everything that you're getting. Your fluids, your antibiotics. I just gave you furosemide. So I'll be back to check on you in about 20, 30 minutes to see how you're feeling, okay? Okay, thank you. So I'm going to go ahead and clear my mask. I still have my gloves on because I was messing with dirty, sweaty stuff or IV sites. But they not dispose of my shirts and my things like that. Okay. All right. If you have any questions, give me a call, okay? Thank you. Knock, knock. How are you feeling? Okay. Well, let me listen to your chest sounds. Provide hand hygiene, getting my stethoscope, wiping the stethoscope off, listen to the patient lung sounds, make sure you don't have any crackling or anything because there is fluid overload. But I hear crackling, bilateral, upper lobes, lower lobes. Okay, sir, because I do hear crackles in your chest right now, when you're breathing in and out, I'm going to go ahead and give you another 20 milligrams of furosemide. Okay, but it'll be 2 mLs, all right? Okay. All right, so I'm going to get everything together. All right, so got my needle. Provide hand hygiene after preparing my material. Hand hygiene, wash, applying gloves. Okay, so again, now I'm drawing up 2 mLs. Got furosemide right here, alcohol, everything is ready. Now I got my 3 ml syringe. Draw up 2 mLs of air. Just pull back a little bit more. Got my 2 mLs. Okay, sir. I'm going ahead and going to give you this other 2 milligrams. So again, before I give it to you, can you verify your name and date of birth? Okay. And your allergies? Okay. All right. So because you're having the sounds in your lungs, I'm going to give you an additional 20 milligrams. Okay? Okay. 1, 2, 4, 5, 6, 7, 8. Okay. You give it slow over like 30 seconds, depending on how much you're giving. If the amount of time or what you're giving, depending on how fast you give it IV push. Okay. 20 milligrams given. Safety engaged. All right. Flush. Oh, no. Okay. Not flush after. Okay. Um. All right. So are you feeling okay? Any questions? Okay. So I go document what I just gave, what time I just gave it, how the patient tolerated it, make sure it's in the right, verify all the information, medication against the mark. Check his fluids. Everything seems to be going good. Still dripping. What else? And that's it for that part. But then I'm going to come back. All right, sir. Knock, knock. How you doing? Yes, sir. We look like you got an order to finally get a discharge to go home. Come on DC or IV. And then you're going to have a follow-up appointment with the doctor at his office in 1 week. Okay? Okay, thank you. So let me get everything I need. Okay. I got me some 2x2s. Okay, sir. Do you have any questions? I provide hand hygiene, put on fresh pair of gloves, put your goggles on, which is, mine keep falling on the floor. Go ahead and start loosening, stop the IV fluids. Fluids run, everything stops. Yes, stop, turn the pump off. Make sure this is clamped. Go ahead and disconnect IV fluids. Okay, IV fluids is connected. All right, we're going to start moving the tape around the site. Want to make sure that's all loose. All right, that's out. We're going to pull the catheter straight out. Don't apply too much pressure. Tip is in place. Site is okay. Apply pressure until bleeding stop. You apply a band-aid or a pressure dressing. All right, bleeding has stopped. Patient secure, tip in place. Wrap it up in your gloves. Outer, inner. Clean up your mess. Secure patient. Raise head of bed. Lock the bed. put it in the lowest position, safety precautions, discard your sharps, medication securement. That's it. And that's my IV video. INT conversion, giving IV push meds, dosage. Again, I'm going to document everything that I did today. When I DC'd it, what time, it's order home, what time is appointment, make sure that's set up, follow up, patient care, um, site, how was it in a lot of bleeding, a little bleeding, the INT conversion, what time that happened, how long it was going, when he returned, what I did, flush it before and after, flush it before, you flush it when they come back, make sure it's still patent because you don't know what was in it, and things like that. So, and flush it before you restart the IV. And that's it. DC converted. This is Marsha Myers signing off.